I wanted to talk today about phantom pain. Now, this is something that is not particularly common and especially not particularly well known. But if you or somebody you know has phantom pain, then it may be useful to have some more information about it. Phantom pain refers to pain in a body part that is no longer present. So typically, for example, we would be thinking about that for somebody who's had amputation of part of their lower limb, for example. It might be a below-knee amputation, an above-knee amputation, and of course it can also occur in the upper limb. And in theory, it can actually occur really for any body part, up to even removal of teeth and phantom pain in the tooth area. So it's quite an interesting thing that has puzzled medicine for over a century now in trying to understand why does something hurt in an area that no longer exists. And part of the time we used to try and say, well, is it coming from the remnants of what is there? Is it coming from, for example, somebody who's had a below-knee amputation? Is it coming from the stump? Is there something in the stump that is sore or painful? But what we've come to understand is that this is something related to the way the nervous system actually functions and the way it almost wants to fill in for the missing body part. If you talk to people who are amputees, they will tell you fairly universally they have phantom sensations. That's extremely common. So they might have a sensation that the foot is there when it's not, or part of their lower limb is there. And often that sensation is distorted, so it's not their exact normal foot as it was before they had the amputation. It might be shortened, what we call telescoped, or other changes. For example, the foot might be put out to one side rather than straight, for example. And that really doesn't cause too much of a problem because there's no actual pain involved. But a smaller group of people will actually end up with pain that develops in the number of months or occasionally a couple of years later in that body part. And then that is what we refer to as phantom pain. And it can obviously become quite distressing and debilitating because it's obviously a focus for the person. Now, what we understand essentially is that the part of the nervous system that is involved is actually the part at the level of the spinal cord, and the little nerve that goes into the spinal cord, it's a little area called the dorsal root ganglion, and it becomes overactive and actually starts to fire off pain signals because it is lacking an input from the peripheral body part. So it's almost like there is an oscillation or hyperactivity of that part of the nerve as it goes into the spinal cord, and then that has further effects upstream as the signals travel up towards the brain. So it's certainly a real pain in terms of what the person is experiencing. Now, a recent analysis, probably a few years old now, 5 years old, looked at something like 40 different treatments and said most of them didn't work very well. And that kind of tells you that all the treatments were targeting the wrong kind of thing if none of them really worked particularly well at that point in time. So we know that medications are poorly effective for this condition. We certainly trialled different medications, but at the end of the day, often we move past that because we're not getting the results that we actually want to see. Nowadays, we focus very much on a couple of things. One can be what we call sensory motor integration, where we're actually encouraging the brain to re-perceive the body part as normal, and where you have a prosthesis that's present, that helps that process. And making sure that the person is actually walking about and ambulating on their prosthesis so that the stump is getting feedback seems to be particularly helpful, and there's various physical therapy programs associated with that. In addition, we can actually start to change the way that little nerve called the dorsal root ganglion, as it goes into the spinal cord, actually behaves. So we can actually change the way it behaves by stimulating it, and that can be with a procedure called pulsed radiofrequency urotomy. And then in a small number of cases, not many, but a small number of cases, we'll actually put a tiny electrode next to that dorsal root ganglion to stimulate it on a regular daily basis to actually block and reduce the phantom pain. And that's called dorsal root ganglion stimulation. And that can be trialled first over a period of time, over a week, to see whether that's something that's going to be effective. So something that was once the bane of many people's lives, that they had to suffer after having had an amputation, is now something that we can reassure people has a treatment pathway associated with it. and our better understanding has allowed that to occur. And as further research occurs, I think we'll be able to refine things further and provide even better results.